Friends, today we are going to study ventilation, perfusion and diffusion defects in the lungs. Now, first we will study ventilation defects. Ventilation defects are the defects occurring due to obstruction in any upper respiratory tracts. For example, nostrils or trachea or terminal bronchi or principal bronchi. All the upper respiratory tract obstruction will lead to ventilation defects. For example, this is your alveoli. Now, defect will be in upper respiratory tract. There will be ventilation defect. Now, I would say one thing, there is pulmonary capillaries going here. Pulmonary capillaries, blood is going from this vein to the arterial side to the venous. This is pulmonary artery bringing back deoxygenated blood from the right ventricle. This is the capillary bed of the pulmonary vessel, pulmonary capillaries, and this is the pulmonary vein which is carrying oxygenated blood to the left atrium of the heart. Now, if there is ventilation defects, air will not come inside from the upper respiratory tract to the alveoli. Now friends, I am showing just one alveoli. There are millions of alveoli in your lungs. Okay, so ventilation defect, we are talking upper respiratory tract obstruction is there and there will be no air coming in the alveoli. Okay, so this space will not contain O2. So the blood which is coming from the right ventricle to this capillary and going back in the pulmonary vein, here the partial pressure of oxygen and here the partial pressure of oxygen will be equivalent or equal. Now, as it is equal, there is no exchange of gas between this. So, ventilation defects produces shunts. Now, there is shunting of blood when there is ventilation defect. Shunt means there is no oxygen exchange between the capillary bed of pulmonary capillaries and the alveoli. So, ventilation defects produces shunts. Now, the next thing, we will be discussing about the perfusion defects. Perfusion defects. Perfusion defects are defects. Again, this is the alveoli, one alveoli cuffed. This is the capillary bed. This is pulmonary artery, this is pulmonary vein, and this is the capillary bed. Now, in perfusion defect, there is obstruction here. There is obstruction present here. There is no problem in gas coming to the alveoli. No problem in upper respiratory tract. The problem is here. The problem is in your pulmonary artery. So blood will not come here. Blood will not come here. But the oxygen diffusion process is good. Oxygen is coming here. So perfusion defect will produce a dead place, dead space. Okay, and now this is not an anatomical dead space. Now, friends, there is two types of space in our body. When we talk about respiratory system, one is respiratory zone and one is non-respiratory zone, or non-respiratory zone is called anatomical dead space, which includes our trachea, our bronchi and terminal bronchi. Okay, so why they are called dead space? Because dead space doesn't comes under the gas exchange. In dead space there is no gas exchange present. Gas exchange is present in the respiratory zone. It starts from terminal bronchi and to the alveoli and alveoli tufts, all that. Okay, all the echines of the alveoli in all the lungs. So in perfusion defects, there is obstruction in the pulmonary artery, or there is obstruction in the blood flow in the lungs. So that will produce a dead space, and this dead space will not be anatomical dead space, this will be a pathological dead space. This is pathological dead space. So ventilation defects produces shunts, perfusion defects produces pathological dead space. Now the third kind of defect, which is the diffusion defect. Ventilation defect, perfusion defect, and the third and the last is the diffusion defect. Diffusion defects. What is diffusion? Simple. From higher concentration, movement of gas from higher concentration to lower concentration. So again, this is the alveolar echini. This is the blood flow. This is same pulmonary artery, pulmonary vein, and this is the capillary bed. Okay, now oxygen from this alveoli has to diffuse through this membrane. Actually this is not that much far, but I have shown it just for convenience. It has to diffuse from it and come to the blood vessels here, so that oxygen here will be present. It will be taken up by hemoglobin, RBC molecules. So O2, it has to transfer from here to here. Okay students, so if there is problem in this diffusion, if the problem is in this membrane, if it has fibrosis, then it will be very tough for oxygen to come from this alveoli and diffuse through this membrane and come to this capillary bed. So this type of defect produces diffusion defects, and the example of diffusion defect is fibrosis. If there is pulmonary fibrosis, it will lead to diffusion defect. Now friends, I explained you what is ventilation, what is perfusion, and what is diffusion defect. Now simple review. Ventilation defects. Ventilation defects produces shunts. Perfusion defects produces pathological dead space, and diffusion defects doesn't produces anything, but diffusion defects are because of the fibrosis, pulmonary fibrosis. Now friends, can you cite ventilation defects? Ventilation defects includes the obstruction in upper respiratory tract. Example, COPD is one kind of ventilation defects. Perfusion defects includes what? Pulmonary embolism, big pulmonary embolus in the pulmonary artery can lead to perfusion defect. Diffusion defect produces diffusion defect will be produced by pulmonary fibrosis, the membrane which is not intact for transfer of oxygen from the alveoli to the blood vessels or the capillaries. Now students, for quick review one more time, I want to say one more thing about this. The transfer of oxygen from the alveoli to the capillary and at last to the hemoglobin. Now for say example, this is one alveoli and this is the vessel. Let's say this is pulmonary capillary. Oxygen will come from the upper respiratory tract to this alveoli, O2, then it will transfer to this membrane. Okay, this is physiological thing. O2 will go to this area, interstitial space. Oxygen is present here, oxygen is represented by the point, red point. Then it will diffuse one more time to this. This is all our endothelial cells. Endothelial cells are specialized epithelial cells which are present in the lining of the capillaries or the vessels. Endothelial cells. Endothelial cells. So these are present here. It will diffuse through endothelial cells and come into this blood vessel, O2. Now, here hemoglobin molecule is there, which has 4 spots. Now, hemoglobin molecule, O2 molecule will go into this one place and sit on that hemoglobin place. It will stick to hemoglobin. So, now this is the way the O2 is transferred. Now, friends, this O2 which is dissolved in this liquid, in this plasma, in this blood, this O2 which is dissolved is the partial pressure of the oxygen. Partial pressure of oxygen is the dissolved amount of oxygen present in the plasma. Okay, and how much oxygen is going inside the hemoglobin molecule? This is the saturation of oxygen. So, what is partial pressure of oxygen? Partial pressure of oxygen is the dissolved amount of oxygen in plasma. And what is oxygen saturation? Oxygen saturation is the amount of oxygen getting into the hemoglobin or going into the hemoglobin and sitting at the hemoglobin chair. There are 4 places where oxygen sits. So one hemoglobin contains 4 oxygen molecules. So simple. Oxygen will come from the upper respiratory tract, it will go to interstitial space, then it dissolve in the plasma, and then at last it goes to the hemoglobin. This all for now, friends.